Hello everyone, I'm Dr. Divya Madan. Welcome back to my YouTube channel. I'm currently pursuing my residency in pediatric medicine from SMS Medical College, Jaipur. And in this video, I'm going to tell you what all things are in there in my bag that I carry every day. In the initial 2 years of my residency, I used to have a bigger bag because I have to carry a few of the hospital supplies as well, so that in emergency cases I have all the things handy. Also carrying a lot of clerical works, files and everything. And in the final year there's much less of a clerical work and more oriented towards studies and basic clinical instruments. So without further ado, let's get started with this video. So firstly, my bag here is from Uppercase, a 17-liter backpack. And the good thing about this backpack is that it's really handy and feels like really weightless. So it's orange and red, and I have my water bottle, a 1 liter water bottle in the side pocket, and it has two compartments. One is the smaller compartment and one is the larger compartment. Let's dig into the smaller compartment first. So in the smaller compartment, I have two spray bottles. One is the hand spray, and other is a small deodorant for all the times that we sweat and feel disgusted about ourselves. So I usually carry this mini perfume bottle so that I feel freshened up after hectic duty, or somehow if I am feeling low or sweaty. And this hand spray is a cleansing hand spray, so it can be used on the surface as well as on your hands, and it's really moisturizing, so I use this one. You can carry gel based sanitizer as well, they work amazingly well, but I prefer spray because you can apply it at the surfaces as well. So another thing in my small compartments are my AirPods. For all the time you need to zone out or contact to your mates without picking up the actual phone, these come in handy. So the next thing here is my wallet, which has my IDs and few cash. The last thing in the small compartment is the small notepad, which is just tear and throw. So I write down all the important tasks that is to be done in that day and pass it on to my junior, or just throw it once the task is done. So now digging into the bigger compartment. So the bigger compartment here, I can gain access through this part also, through the major chunk also. So it is very easier. So in my bigger compartment, I mainly have gadgets. You can see it's not that organized, but still. So here's the small notebook in which I usually write drug dosages or some points that are discussed in the rounds. I have this smaller notebook in which I jot down points if all I'm studying in the ward and I need to write down. The next thing is this pouch. This pouch is just everything. It's made out of jute. It has all the stationery items that I would need. It has a mini stapler, small tape, duct tape, also a set of highlighters. I have one or two pens and one permanent CT marker. I have these invisible sticky notes. I have my seal and some items that will be used in the clinical examination, like this pulse oximeter, reflex hammer and an LED torch. Also I have an inch tape with me, a retractable inch tape, so that anthropometry of children is easier. Now coming on to the next thing in this compartment. Now coming on to the gadgets. Apart from the AirPods, I carry these headphones as well. These are the noise cancellation headphones for all the night duties when I need to study. And in ICU or PICU, there is a narrow window where you can study. And at that point, I feel very distracted from the loudspeakers or the alarms. And at that time, I use this. So these are for very brief breaks where you want to zone out. So a noise cancellation headphone is good. I use Sony WH-720N. So the next thing is my laptop. I have the laptop charger. I carry my tablet as well. I don't carry hard covers during my duties because they're heavier, and also you cannot refer to multiple sources and carry multiple books. So carrying a tablet makes it easier to have multiple sources at one place. You can jot them down. Apart from these gadgets, I also carry a coffee mug. This coffee mug is important for me because I feel really sleepy during the daytime, and my sleep cycle is wired that way that I'm more functional during the nights. So I usually carry a coffee mug, cold coffee in summers and hot coffee in winters. So that's all that I have in my backpack. I hope you like this video. Thank you. Have a nice day. Bye.